Congressman Adrian Smith joins us now from Washington, D.C. Good morning, and thanks for taking the time to speak with us.
Thank you.
First of all, the big topic right now in Washington is health reform. I understand the House will be voting on a bill in a couple of days. Tell me, where do you stand on that bill, and how will the reform process, how's it going in general?
Well, I'm not in favor of the bill. I think it's a reach of government that goes way too far. I think the unintended consequences, although they won't be felt right away, because actually the bill won't take effect for 4 years, even though taxes will be increased right away, the benefits wouldn't even be felt for 4 years. That's one problem. But it's a huge reach of government. I think that it stands to reduce access to health care in rural areas. There's a provision that would require usage of an MRI to the level that only urban areas might be able to fulfill, and yet it would force rural folks to probably drive to an urban area and then end up standing in line. That is a huge concern that I have, and that's just maybe one page of the 2,000 pages that are included in this bill.
What do you think Nebraskans need to see in a health care reform bill if one gets passed?
We need to see more choices in terms of insurance coverage. The government forming an insurance company and running the insurance company, and oh, by the way, drafting and mandating what other insurance policies look like, that's not the way to go. We need to foster policies like enabling consumers to buy health insurance policies across state lines. That's virtually what the coverage for members of Congress includes. This is a national plan, but it's offered in the private sector, Blue Cross Blue Shield, incidentally. The fact is, though, it's about opening up access rather than the hand of government saying this is what it should look like and mandating individual coverage. And really, it's very anti-innovation. There's even a tax on medical devices. And so it really points to the fact that the sicker you get, the more taxes you will pay.
In that case, then, what type of components are you looking for in a bill that you would approve?
Well, I know that pre-existing conditions or the perception thereof is a big issue. And so that's why I think that when we look at what we need to do, we need to make sure that someone doesn't find themselves being excluded because they got sick, or they get their policy canceled perhaps because they got sick or they met a lifetime maximum. And then all of a sudden they can't get insurance elsewhere because they were kicked out of another plan. That's a problem, and I truly believe that the Republican alternative does address that in a much more cost-effective way that does not spend $1 trillion and offer actually we're talking about Speaker Pelosi's bill creating 111 new government bureaucracies virtually. We're talking about new boards, commissions, agencies, task forces, over 100. And those are expensive, not only paying the staff for those various entities, but the kind of expenses that they will generate for the American people, for American taxpayers, and I think of putting our country in further debt, which is certainly not the way to go.
Speaking of debt, another hot topic is the economy. We've heard a lot of reports about the economy turning around and starting to recover. Do you agree with that?
Well, there are some good signs for the economy, but one of those signs is not higher employment. Unemployment is on the rise. Congress is passing a higher, increased unemployment compensation. A jobless recovery is not the direction we should opt for. And I think that this stimulus bill that was passed last winter really kind of encourages a jobless recovery. It's certainly not a sustainable recovery. And we want sustainable economic growth, and I think we do that through reduction in spending, at least reining in spending instead of increasing it at the rate that we've seen over the last several months.
What are some of the big issues you've been hearing from Nebraskans right now? Some of their biggest concerns. Is it the economy? Is it health care?
Well, it's healthcare, it's the economy. Probably I've been hearing in that order. But let me take, for example, we're not addressing energy issues like we should be. Energy is very important to our economy, and I will tell you that if we do see a recovery economically, we're likely to see oil prices go way back up because we haven't taken advantage of an opportunity now to have a broader-based approach to energy production. whether it's a modest policy for exploring for domestic sources of petroleum. But I know that wind, solar, what I call all of the above, biofuels are important. We want good, balanced energy policies so that our economy can thrive from it rather than suffer from it.
I believe there's climate change legislation out there right now. How would that affect Nebraska as we're talking about fuels and that?
Well, the climate change bill, the cap and trade, as it's called, it passed the House last early July, and it probably will not pass the Senate. I know that today the committee over in the Senate did advance it out of committee, but I don't see it having the necessary votes in the Senate, which I think is a good thing. I think it's especially punitive to so many aspects of our economy. But just today in a committee hearing, we had a witness tell us that eating beef is bad for the environment. Notwithstanding any nutritional issues and benefits, but it's comments like that by advocates of the cap and trade bill that I think are not only bad for Nebraska's economy and rural Nebraska or rural America, but it really lacks some forethought in terms of the big picture. I mean, the cap and trade, without the participation of India and China, just sends our jobs over there. And it certainly would hurt jobs across Nebraska, whether it's agriculture and increasing the overhead costs to agriculture, or whether it's hurting jobs in the rail industry, for example, all across Nebraska.
All right, Congressman Adrian Smith joining us from Washington. Thanks for joining us this morning.
Thank you.